Plastic surgery is transformation. Whether cosmetic or reconstructive, doctors are changing lives. Real stories, groundbreaking procedures, ultimate makeovers. This is plastic surgery, before and after.
Hi, I'm Dr. Jan Adams, a plastic surgeon from Laguna Beach, California. Many people think the plastic in plastic surgery refers to the materials we use. It actually refers to our ability to shape and mold the human body. In this episode, a woman is deeply embarrassed by her misshapen breast. She hopes reconstructive surgery will give her the balance and self-confidence she desires. Up first, we'll meet a man who's dedicated to transforming the lives of troubled kids, but wants his own makeover.
In Toccoa, Georgia, 43-year-old Steve Matero, a successful building contractor, has created a rural paradise.
The 80 acres is breathtaking. It's rolling pasture. We got horses. The weather's just beautiful, nice breezes. We got ponds for fishing. It's just a wonderful, wonderful environment.
Steve has turned his personal oasis into a sanctuary for troubled youth.
And what we do is we take young men, mostly broken men, that are meth addicted, on drugs, crack, and we take them up here on the property. It's a 2-year program, and we teach them a trade.
Go ahead. Go ahead, Bill.
The skills learned by the young men are soon used to help others.
We're going to pre-cut these 4 walls here. All right, what we do here is we build houses for the homeless out of scrap material. It holds about 4 people. These right here, let's get this one up and framed up real quick. We take them out when the weather gets bad. We know we're going to have storms or cold weather. A lot of times it's going to be too hot. We drop these off in bad neighborhoods or rundown neighborhoods where the homeless are living in Atlanta and other parts of Georgia. 1, 2, 3, let's go. And our goal is to do about 1,000 a year with these guys. Every one of these houses are built out of the material that's thrown off with their jobs. Lay it over down the side. And we store this material up instead of throwing it in dumps or in a burn pile or being hauled off. Good job, guys. So it's absolutely, basically free to build them, and it's volunteer labor from us. All right, guys. Another one down.
When working with at-risk youth, Steve knows that he has to project the image of a strong leader.
All right, let's get something else done. These guys are rough, they're tough. They've been around the block. They're not going to look up to somebody that they think that they can take advantage of or push around. You have to be able to stay in control.
Physically, Steve is in top form, but he worries that as he gets older, the young men will not be able to relate to him.
As I get older, at 43 years old, the next couple of years are going to play a big difference on whether I'm the old guy they're following or I'm the leader that they're looking up to.
Steve has another reason to keep a youthful appearance.
I was blessed 5 years ago to meet the woman of my dreams. I fell in love with her. She's 26 years old now. She was young when I met her. She's absolutely beautiful. She's given me 2 beautiful children. Here we go. At 42 years old, I feel like I'm 22 years old. It's a good feeling to be physically in shape, but also to look in the mirror and not see what I feel is devastating inside.
Steve has decided to consult with Atlanta specialist Dr. Brian Maloney about a facelift.
Hey, Tua, why don't we stand up in front of the mirror here?
Okay.
And why don't you share with me what you're thinking about?
I've got probably 25 years of sun damage working out in the field day to day. I feel like I've got my jaw over here seems to be sagging a little bit under my chin. And I've had my nose broke several times from boxing when I was younger. And I have a very bad breathing problem in here, and I snore at night, and it affects my sleep. And I'm sure that upsets the wife.
I've saved many marriages by straightening noses, so we'll
save mine.
For Steve, Dr. Maloney recommends a chemical peel for his hands, arms, and neck, a CO2 laser peel, neck liposuction, a neck lift, a facelift, an upper and lower eyelid lift, lip augmentation, fat transfer, and rhinoplasty, a total of 9 procedures. The day for Steve's surgery has arrived.
We're going to have a little incision that's going to start back in the hairline.
We're good to go, my love. Rock and roll.
And just gonna set this right over your face, just like that, okay?
This is the first stage of the procedure. We're going to do a chemical peel.
The chemical peel uses caustic agents that burn away the top layers of skin on Steve's sun-damaged arms, hands, and neck.
The chemical peel is all done. We're going to go ahead and turn the table and prepare him for the CO2 laser.
Plastic surgery is rapidly advancing because of new technology. As a result, we haven't discovered all the limitations of a particular tool or procedure. The CO2 laser is a perfect example. In Steve Matera's case, he's having the laser resurfacing done only on his face, not on the rest of his body. CO2 lasers have been used extensively on the face with good results. It may turn out that they work well on other body parts too, but until we have solid data to back that up, the take-home message is to be cautious and stick with the more tried and true process, like a chemical peel.
Laser resurfacing works by vaporizing the skin and removes more layers than a chemical peel.
It's important for us to get down into the supporting layer of skin, to the collagen layer, to have any type of long-term results.
The CO2 laser resurfacing is completed. The doctor begins liposculpting Steve's lower neck by making a small incision below his chin.
I like to use the liposuction cannula without suction to start with, because that gives me a little more control.
Next, the platysmoplasty. This procedure tightens the muscles in Steve's neck area, giving it a more defined appearance. After completing the platysmoplasty, he begins the fifth procedure, the facelift. An incision is made around the ear. To reverse the effects of gravity and aging, the connective tissue layers under the skin are lifted and sutured into a new position. The excess skin is removed.
We just took off about 1.5 inches of loose skin.
The facelift is completed on the left side. The doctor begins the lower eyelid lift.
With the lower eyelids, our plan is to go on the inside of the eyelid, and through 3 little pockets here, we're going to remove that puffiness.
He removes fatty tissues under the lid to give it a smoother appearance. Next, he begins the upper eyelid lift. Here, it's excess skin that's removed.
Upper eyelid blepharoplasty in a male is a very delicate procedure. We want to be very conservative with the amount of skin that we remove.
For the 8th procedure, alloderm or cadaver tissue will be used to augment Steve's lips. An incision is made on each corner of Steve's mouth, and a tunnel is created. Then the alloderm is pulled into place.
He has an instant upper lip for the first time in his life.
Next, fat harvested from Steve's abdomen is injected into his mid-face area.
The fat that I've harvested, I'm placing that in the area between the cheek and the mouth, the nasolabial fold area.
The final procedure begins, the rhinoplasty.
The basic architecture of the nose is pretty well shot. Here's Steve's cartilage. What we're going to do is we're going to place 2 beams on the side of that to sandwich that in place to help straighten that up.
2 internal splints will be permanently sutured into the septal area of Steve's nose.
Okay, so that's as straight as Steve's nose has been in probably over 20 years. Overall done. Steve did absolutely wonderful.
After a total of 9 procedures and 4.5 hours of surgery, Steve's wife joins him in recovery.
Hi, honey.
How you feel? You have a great set of lips.
Beautiful.